Hello friends, welcome back. In this lesson, we shall be taking a look at the foundations of homeopathic pharmacology. This is just an introduction, and as we progress with the course further and we look at individual remedies, we shall learn more about it. But this is going to change your perspectives about pharmacology. In the allopathic practice, for instance, a drug is introduced mostly after some randomized controlled trials have been done on that particular drug. The fundamental purpose of the trial is with an end point in view. In other words, I could be testing a drug with the intent of finding whether it will be effective in, say, malaria or typhoid or any other such disease. Homeopathic pharmacology has a different take on this, and we shall see that as we progress along the lesson. The first question that should come to our mind is, are randomized controlled trials, that is, these double-blind trials on drugs, the gold standard? We are made to believe that they are in fact the gold standard, but that is not entirely true. Indeed, RCTs, or the randomized controlled trials, have the ability to control numerous sources of bias and confounding. But we must remember one thing, that RCTs only establish that the treatment is effective in the test population. That test population is often quite different from your patients. For example, most of the drugs developed today undergo double-blind, randomized controlled trials in developing countries. It could be in Africa, India, and so many other places. And the people on which these trials are done are not representative of the population where these drugs will be used, even within the same countries or in the same continent. So all that it establishes is that in the test population, it worked within these statistical limits. Another important point to remember is that the typical test population is different from the target population in terms of ethnicity, in terms of culture, in terms of availability of medical care. Therefore, RCTs are not truly the gold standards, although all of us would assume that to be so or wish it was so. All that we must remember is it has limitations. I would like to draw your attention to the fact that a lot of drugs that you use in day-to-day practice are being used without any RCT backing. I give below a reference which you can refer to, and I present the summary here. This study analyzed data over the course of 15 years, from 1999 to 2014. And they studied the data which is available from the European and US regulators, that is the EMA and the FDA. They found that 403 drugs were granted approval, and 64 drugs out of these were not tested according to double-blind studies, or RCTs as we call them. That forms almost 15% of the drugs that were granted approval. Also important to note is that almost 66% of the drugs that are used for cancer care or cancer treatment do not have the backing of a randomized controlled trial. This is just nice to know information, and that makes us in a better frame of mind when we view homeopathy. One of the major complaints against homeopathy is that no double-blind, randomized controlled trials have been done on the drugs, but that's not entirely true. In the past 3 decades, we do have a lot of very good studies, and I shall refer to them when it comes to another chapter. We must also remember that RCTs are not the only option or only way that a drug enters clinical usage. We have animal studies also, but beyond that we have what we call as observational studies. And also we have case reports. We shall take a brief look at these two ways of bringing drugs into clinical practice. Observational studies, as the name suggests, are studies or the information that is gathered by observing the use of a drug, not necessarily under the conditions demanded by randomized controlled trials. They often begin by reporting a recorded correlation between the drug and the drug action. They can be very effective, but they are not supported by RCT, and some examples are penicillin in the treatment of pneumonia. That's a very standard method of treatment, even approved by the World Health Organization. But you must realize that penicillin in the treatment of pneumonia is not backed by a randomized controlled trial. The same applies to the very common use of aspirin for mild headache. Did you know it is not backed by any RCT? Likewise, the use of diuretics for heart failure is also not backed by any RCT. Appendectomy for acute appendicitis is the standard procedure adopted in hospitals, but it is not backed by an RCT. Another beautiful example is using a rabies vaccine in combination with epinephrine for anaphylactic shock. It doesn't mean that they are unsafe. They are very safe, and they are standard protocols which are followed by highly qualified doctors, and they are approved by health organizations of the respective countries. But I just wanted to point out that these are based on observational studies, not on RCTs, which in fact is a relatively new phenomenon in pharmacology as we understand it today. Let's have a look at some findings. There is no clear evidence that RCTs are always more reliable than observational studies. Let's look at an example. Hormone replacement therapy seemed protective for coronary heart disease in observational studies. This is what they found in observation. And what did the RCT tell us, or what were the observations in the randomized controlled trials? Quite the opposite. RCTs indicated an increase in coronary heart disease in first years of use. So they are quite contrary findings. So once again, the point I wish to make here is that RCTs are not the only source of information that back up the correct usage or usefulness of a drug. As mentioned earlier, apart from observational studies, case reports also form a large body of information for drug use. They remain extremely popular in medicine. They describe the medical problem of one or more patients. Mind you, we have formed an impression in the mind that such case reports are anecdotal, but they are not. They are accepted in research circles as a source of information for bringing a drug into use. As a matter of fact, they give a very close and good presentation of disease, diagnosis, and treatment outcomes of patients. The beauty of case reports is that they focus on practice-based observations and clinical care. So instead of using some population for RCTs which do not represent the users, these case reports are based on observational clinical care which are representative of the population which is going to use the drug, or the patients that you are going to handle in your clinic. Another advantage is that single cases focus on highly unusual manifestations. Very often, drug trials cannot, by the very structure of the study, attend to highly unusual manifestations of a particular ailment or disease. As a matter of fact, case reports are often described in scientific literature as the science of particulars. This is something very interesting because homeopathy uses remedies in order to address particulars, or it addresses individualization of the treatment. How that is made possible, we shall be looking at it shortly. question is, how is homeopathy different? And the answer is, it is quite different. It requires a shift in the thinking pattern of the student. In homeopathy, we have what we call as homeopathic pathogenetic trials. This is a relatively new word, but the word used by all students and practitioners of homeopathy is a word which is translated from German, and in English it is called provings. Now, what exactly are provings? A proving is the action of a drug on a healthy person. That drug is, of course, not in the form of a raw drug. We shall be looking at that in greater detail later in a different module. But for now, it is suffice to say that it is in a highly super diluted state. So the healthy participants take a substance and they make a record of all the symptoms that arise after taking the substance. This substance is prepared as per the homeopathic pharmacopoeia, which is not the point of discussion in this lesson. And the record of all the symptoms is collated. It uses many volunteers who are in a normal state of health, and they cover a large spectrum of people: men, women, girls, boys, elderly, young, people with certain ailments which they are suffering, and what are the changes in symptoms that they observe. So all this information is collated. It's a long process, and it's over a specified time frame after taking the dose, and the participants are blinded to the identity of the substance. Now, the observation of symptoms by the individual people who participated in the trial are recorded. I will now describe the process of adopting a remedy into homeopathic use. As we saw in the last slide, the symptoms or the homeopathic pathogenetic trial records are collated. They are then written down in a book called Materia Medica. There are many various editions by various authors, and they are written in a narrative form to make it more understandable. After that, it is tested for clinical efficacy. The basis of homeopathic philosophy, as we shall see in a different module, is that people who present with such symptoms as were exhibited by participants of the homeopathic pathogenetic trial, these substances will act as a curative agent. So the clinical efficacy is tested, and then finally it is then collated in another book or reference called the repertory, and we shall describe Materia Medica and repertory shortly. Materia Medica is a directory of drugs. That means every drug is listed in alphabetical order, and in those pages are recorded all the symptoms in a narrative form, in a more readable form. They are not just a replication of the provings. For example, here is a very popular book which is used in the clinic, Materia Medica of Homeopathic Medicines by Dr. S.R. Phatak. And here is an extract from another Materia Medica. As you can see, this is for the drug called belladonna. And this runs a few pages, and this is just to give you an idea of what it is. Let me illustrate this with an example. The drug belladonna in a proving produced one such symptom. The boy jumped out of bed, he talked a great deal, was lively and laughed very often. The consciousness was entirely gone and he did not recognize his parents. This is with one particular person who volunteered for the homeopathic proving. In Materia Medica, this could appear as an excited mental state, jumping out of bed, loss of consciousness, and does not recognize people. So you will see here that the language of the patient has been modified into a form that is more readable and understandable and more concise. We also talked about something known as a repertory. This is quite the opposite of materia medica. While materia medica was a directory of medicines, repertory is a directory of symptoms. I'll just explain this with a few examples. In the previous case, for example, in the repertory, that symptom about the child being excited will appear in the repertory as mind excitement in children. As you will see, there is a list of numerous remedies. Belladonna happens to be one of them. In other words, aconite, ambragresia, lycopodium, and so many others would also produce a similar symptom to a lesser or a stronger degree. Another symptom in the previous example was that the child was jumping out of bed. Here, once again, we have a number of remedies. Some of them are in bold letters in red, and some of them are in blue in italics. Those in italics and capitals are those remedies which had a pronounced effect of this particular symptom, jumping out of bed. Belladonna appears here too. Another one was unconsciousness or semi-consciousness. Once again, belladonna appears here, but as you can see, it is neither in capitals nor in italicized capitals. But this symptom also appeared in some cases. Does not recognize people, especially his relatives. That once again is a very important symptom of belladonna. As you will see, there are so many remedies which overlap. The beauty of homeopathy is that it is a healing art, and in this lesson you shall learn how we'll be navigating through this maze, and not just navigating through the maze, but we'll be achieving results that will also amaze. They will amaze you as well as your patients. Belladonna is a very important remedy, and we call these remedies as polycrests. A polycrest means it produces many symptoms in many parts of the body, and they are very well documented. Belladonna produces more than 20,000 different symptoms, and out of these, more than 900 are unique. In other words, they are just like your fingerprint. These unique symptoms are those which are produced only by belladonna. I'm sure you must be getting the drift now. When we have a collation of symptoms and we learn how to do a grading of symptoms and prioritizing those symptoms, we shall be able to use simple mathematics of sets, set mathematics, and use of Venn diagram theories to arrive at the correct remedy. That brings us to the end of this lesson. This was full of new concepts. You might like to listen to this over and over again just to get your frame of mind attuned to the homeopathic approach. So thank you very much for your attention, and we shall meet once again in the next lesson. Until then, bye-bye.